Thanks, Jonathan. I suspect a lot of people in the room know a lot more about the town of Jackson, certainly the county of Teton in Wyoming, and maybe even Teton County, Idaho, than the hospital. So before I get into a view on status, let me give you a very quick description of the hospital, kind of our mission and objectives, and then our status vis-a-vis our mission and our objectives. We are a nonprofit community hospital. We are in fact an independent governmental unit, the Teton County Hospital District, with an elected unpaid board of trustees. We have 48 hospital beds, including a brand new OB wing and 60 nursing beds. We have an emergency department that's staffed 24/7 by board certified emergency physicians. We have 6 brand new surgical suites and a brand new oncological center. We have state-of-the-art technology in the form of MRIs, CTs, and telemedicine equipment. We have a medical staff of roughly 60 full-time equivalents, and we performed last year roughly 2,800 surgical procedures, many of them outpatient, but many of those patients also ended up in the hospital as inpatients. As set out here, the St. John's mission is patient-centered clinical excellence and community wellness. In carrying out that mission, we are committed to 4 objectives. First of all, a quality of care that meets or exceeds that of top hospitals elsewhere in the U.S. This is really the paramount objective. Secondly, the broadest possible scope of clinical services consistent with excellence and financial feasibility. We don't offer all services. We do not have invasive cardiology, for example, because there's not the demand to keep the technical expertise or the financial viability associated with that kind of a practice. We're also committed to expanded community wellness programs, and lastly, the enhancement and preservation of financial strength. With that background, let me give you a personal view of status. I think we have made great progress and are doing well on all 4 objectives. Achieving the first 3, achieving and maintaining the first 3 objectives is largely within St. John's control. However, our future financial viability is only partially within our control, and I want to focus on that. With respect to what I see as challenges, I indicated that clinical excellence and maintaining that is perhaps our greatest challenge, but one that we largely delegate to the administration and medical staff who have the medical expertise to work on that. And that's no small challenge in a small and remote medical center such as St. John's. I want to focus on our financial challenge in that financial strength is absolutely crucial to maintaining the quality and scope of our services. It's probably no mystery to people in this room that governmental and private insurers are in difficult financial condition, and they are continuing to reduce the compensation to hospitals. Moreover, some of St. John's vital community services are already or below break even. Moreover, community hospitals in general face competition from physicians and other investors in facilities that focus on the services that have attractive profit margins. As I've spoken to earlier, this competition is not, in my view, competition on a level playing field. Physicians can steer selected patients to facilities in which they have a financial interest. These facilities are not required to provide a full range of services to all comers. They don't provide ED or OB services. They tend not to deal with patients on Medicare, Medicaid, and they don't provide all services. If there are complications that occur in one of these standalone for-profit facilities, that patient is going to end up at St. John's or some other major medical center. Moreover, the costs of redundant investments in for-profit facilities, as well as the profits accruing to physicians and outside investors, ultimately increase community hospital prices and your insurance prices. To deal with our financial challenge, I think that our greatest opportunity lies in the increased utilization by members of this community of the elective services available at St. John's. For a number of medical procedures, elective medical procedures, as well as emergency services, St. John's provides a level of quality that matches top hospitals and surgeons throughout the U.S. As I indicated earlier, this doesn't mean that we provide all elective procedures, but for many procedures, such as total hip replacement, patients don't need to go to Salt Lake City or New York or to Johns Hopkins to get high quality care. This is important because St. John's costs are largely fixed. The increased patient use of our professional staff services and facilities will generally help cover our costs. This in turn will enhance our financial viability. Lastly, let me speak to how the community can help St. John's. I know Jonathan asked that people have only one priority, but I would make three requests of you all, our community. First of all, with respect to the financial challenge, understand the benefits of St. John's as the hospital of choice, the physician, medical staff of choice for a wide variety of elective procedures. The benefits are outstanding clinical care, avoiding the inconvenience, stress, loss of time, and cost of remote care, and lastly, providing financial support to St. John's. Second, as this community has done to a wonderful degree in the past, support our expansion and modernization programs. This is both facilities and state-of-the-art medical technology. Contribute to the St. John's Hospital Foundation, the St. John's Auxiliary, and a number of other St. John's supporters, and support our SPET proposals that may be coming down the path in the future as the community has in the past. Lastly, persuade our legislators to vote for measures that will help St. John's as well as a lot of patients in the state. First of all is Medicaid expansion and other measures that will both benefit patients and cover a lot of the uncompensated care that St. John's presently provides. Secondly, although this is not on the legislative docket in the next session, if we can get our state legislators to vote for certificates of need, this will reduce or eliminate the encroachment of for-profit facilities that are redundant with the facilities already available at our community hospitals. Hope to talk with you all about your ideas for the future. Thanks very much for your attention.